However, his head completely shaved, about a 50-year-old, 60-year-old man.
Okay.
And I saw this big bump on his head. And I kind of lingered looking over his head. In the buses, the driver sits on the buses in Atlanta. The driver sits lower than the passengers. They're kind of like down in a little hole, and then you walk up a couple steps, and then you take your seat. So I was able to go and look at this bump.
Okay.
And I turned to my son. I said, "That's a squamous cancer."
Did he know that?
They have a squamous cancer. So then, okay. So look, now, let's say this guy, he saw 50 doctors. The drive from the hotel to the convention center takes about 10 minutes.
Yeah.
So it takes probably about 2 drives an hour. Each drive has about 50 doctors, so it's 100 doctors an hour. He does an 8-hour shift, so 800 doctors a day, right?
Yeah.
And the meeting was Saturday, Sunday, Monday, Tuesday, Wednesday, 5 days. So let's say, so 800 doctors times 5 days. So let's say 4,000. Let's say not every bus was filled, so maybe 3,000 doctors.
Sure.
And even let's say some of them were nurses and technicians, so maybe 2,000 doctors.
Okay.
So 2,000 doctors that saw his head, saw this bump, and I turned to my son. I said, he's got a squamous cancer. I mean, someone must have told him he's seen thousands of doctors before us. And
Sure.
this is the last trip on the last day.
Right.
So I'm going to leave it to our viewers. You can tell me what you would do if you diagnosed a squamous cancer on someone's head. He's not your patient. He's your bus driver. What would you do? So call us at 800-321-0710, 800-321-0710. And let me know. We'll take this call from Neil. Good morning, Neil. I understand your wife was died with cancer and died within 3 months. I'm really sorry to hear that.
Good morning, doctor.
I'm sorry to hear about your wife who, is that correct? She was diagnosed and died within 3 months?
No, there's a little bit of a discrepancy there.
Okay.
She was diagnosed with breast cancer, metastasized.
Sorry to hear that. Stage 4.
Stage 4. Hormone receptive, aggressive. She went 5 years without chemo.
Okay.
They were using hormone blockers and other things. She ended up with a couple small spots, 1.5 centimeters, lung and liver.
Sorry to hear that.
She also had a swollen node under her arm.
Okay.
The doctor turned around in the first month of chemo. After 5 years, the lump shrank, and the doctor said she was handling the chemo well. Within a week or two after the lump under her arm was gone, she had edema in the entire left arm. She then lost, she went cross-eyed, 6th facial nerve.
Okay.
Then she lost feeling in her jaw.
Okay, so she had leptomeningeal spread of the cancer in the brain. So those are signs that the cancer cells are in the fluid around the brain.
There was no sign. They did a spinal tap. There was no sign of cancer in the fluid.
Well, the spinal taps are wrong about 70% of the time, so you have to repeat it. Did they repeat it 3 or 4 times?
He did it once.
Yeah. Once is not accurate, unfortunately. The cancer cells are sitting around the fluid in the brain, and the spinal tap is taking it at the bottom of the spine, and it's only accurate about 30% of the time, which is why it has to be repeated. But those are signs of leptomeningeal spread, which means cancer cells in the fluid around the brain. So double vision, numbness in the face, facial weakness, she doesn't have to have all those signs, but those are typical signs of cancer cells in the fluid.
The neurologist said that they found YO antibodies. And she literally, since there was no saliva, within 3 months her body was absorbing itself, and she passed away.
Well, I'm really sorry to hear that.
And the doctor said that the lump in the armpit was a tumor, but never did a biopsy.
Yeah. Well, without a biopsy, you would never know, and it's really sad. I'm happy to speak to people who want to come in. I review their records and try to go over details and try to find the answer to get better results. We often see patients like this, and I can't really comment without the record, so it's a little bit difficult, and I don't want to say something that's wrong. We're going to go to a word from our sponsor. I want to hear what you think about the bus driver, and we'll be back in 2 minutes. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212 Choices. 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212 Choices. 212 Choices for Radiosurgery New York.
News Talk Radio 710
WOR.
At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212 Choices, 212 Choices for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212 Choices, 212 Choices. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
We're back. Rob, we're back. So what would you do? That bus driver, you saw that big bump on his head. It looked like a squamous cancer. I would bet my chocolate hat that I'd eat my hat if that wasn't skin cancer. He was bald. It was top of his head.
Right.
A lot of sun exposure. Atlanta, probably more sun than up here.
That's right.
So what would you do?
Well, to be honest with you, I probably would not tell him. Or
Why?
Or at most, what I would tell him is, you might want to get that checked out. Why? Because he's not my patient.
Okay, he's not your patient.
But I can see the argument for telling him. I mean, it's probably in his interest, especially if he doesn't know.
Yeah, but if everyone is like that, and you can't see the top of your head.
Right.
Right. So if it was at the tip of his nose, you could say, wow, he could see it. It's no problem.
Right.
So the top of his head, he can't see it. And what does a person do that's, you know about it and they don't? That's,
Yeah.
I mean, the dilemma, right?
Right.
And then they'll punch in your nose or take out a gun and shoot you. You say, it's none of your business, mister, right? That's what you fear.
Right.
Right. Because you don't think he's going to say, look, I'm J.P. Morgan. I'm going to give you $1 million because you saved my life, right?
Yeah, that's not happening.
Well, what if he was J.P. Morgan? Would you treat him differently?
No,
No?
I probably would not, tell you the truth.
If it was Barack Obama, would you and you get a presidential medal for saving his life? You wouldn't do it?
Maybe for the presidential medal.
Yeah. Anyway, so this was our test, and we think that several thousand doctors saw him, and actually everyone agreed with you.
Oh, yeah?
Yeah, everyone agreed with you. So we sat in our seats, and my son says, you have to tell him. And I, of course, I started the whole thing because I'm the guy that saw it. I told my son. And I said to him, we got off the bus. So as we were leaving the bus, we said, look, there's a bump on top of your head, and it looks like it's we have Michelle here from Wisconsin. She's going to tell us what to do. Michelle, good morning. Michelle went away. We didn't answer soon enough. So we got off the bus and we said, excuse me, I just want to tell you there's a bump on top of your head. And he says, oh, I know it's nothing. I cut my scalp every time I shave my hair. I know it's there.
Okay.
And I said, no, it's not a bump that's causing you to cut yourself when you shave. It's a bump that's caused by cancer, and it looks like a squamous cancer. And probably the best thing for you to do would be to go to a dermatologist and get a biopsy, and you could probably be treated, because if you don't treat it, it can hurt you.
Right.
So it's in your interest to please go see a dermatologist. Please go get it checked out. It's not just a bump when you're shaving.
Okay. So that's a very good way of doing it, though.
So that's
Right.
how we did. And we got off the bus, and he said, thank you. And I said, just check it out, please.
Yeah.
So I felt morally that I had to tell him that there's something there. It's something that can hurt him. And I think ignoring it, I don't know, we're all kind of like our brother's keeper. This week in Jewish life, every week from the Torah, or the Torah is the Bible, really.
Mhm.
So there's a different story. And this is the week of Cain and Abel, right? And Cain killed Abel, right? Because Abel got a blessing from God, and Cain didn't, and Cain was angry, and Cain then killed his brother.
Right.
And when he was asked about it, he said, are you your brother's keeper? He said that was his response. So it was
Yeah.
like a confession. Yeah, he killed his brother. So in a way, we're all kind of our brother's keeper. And I think if we think about life more that way, maybe we'll have a better society. And if I could help this bus driver, why not?
Yeah.
Why not? What did it cost me? It makes me feel like I helped him. I did the right thing. I wasn't embarrassed. So I hope that it's the right thing. And I'm hopeful that he gets care. I didn't give him my card. I didn't have any cards. I can't say, call me, let me know what happens. But
Sure.
I would like to know what happens. And I doubt he's listening to this show in Atlanta. So there's lots of other news at the cancer meetings. There's so much news. One of the big cancers talked about was esophageal cancer.
Oh, yeah.
And we don't talk about it much. It's one of those hidden cancers. It's not a sexy cancer.
Right.
But it affects a lot of people. And there's different kinds of esophageal cancer. There's two major types, squamous cell and adenocarcinoma. So those are diagnosis when the biopsy is taken and the pathologist reviews it. And the usual treatments can be surgical or radiation. Actually, most of the studies have shown an increasing role for radiation, both for stage 1. And stage 1 is confined just to the surface of the esophagus.
Sure.
And those have the best survival rate. So in cancer, when you have a lower stage 1 patients do better than stage 4 statistically, because it's telling you groups of patients and prognoses.
Right.
So most people with stage 1 esophageal cancers are cured. And the new data showed out that increasing radiation doses gives increasing benefit. And there are different procedures, like for people that have trouble swallowing. When esophageal cancer grows, it makes a blockage in the esophagus.
Right.
And some doctors put stents in. Do you know what those are?
Yeah. Basically just keeps the, I guess, esophagus patent.
Right, because the esophagus is like a tube.
Right.
And it's like a tube in your house. If a pipe from your toilet blocks up, everything backs up behind it.
Yeah.
And same with the highway jam. So you put a stent in, it opens up the esophagus. So there's studies out now that actually show that a short course of radiation is better than a stent, that it opens up the passageway better and more permanently than a stent with less side effects. So some of that data was presented. Getting PET scans early was recommended to see where the cancer was.
Okay.
The cancer-free survival for esophageal cancer has increased 400% over the last 20 years.
Wow.
So a lot of people sometimes say, oh, if you have cancer, you're never cured. But actually, it's not true. And there's great increasing cure rates from a lot of cancers, including esophageal cancer. In the United States, there's 17,000 people with a